If you have diabetes, you probably already know how delicate it is to take care of your health in every aspect. But did you know that diabetes is one of the leading causes of severe vision problems, including blindness? Despite this alarming reality, many people underestimate the importance of taking care of their eyes until it's too late. Making mistakes in eye care can lead to irreversible consequences, and we don't want that to happen to you. This video is specifically designed to help you avoid those critical mistakes in eye care. I'll give you practical, science-backed tips that you can start implementing today to protect your eyes and prevent future complications. Number 1. Not having regular eye exams. Let's start with a mistake that may seem easy to avoid but is very common: not having regular eye exams. If you have diabetes, diabetic retinopathy is a constant threat. This condition occurs when the blood vessels in the retina, the part of the eye that sends visual signals to the brain, become damaged due to high blood sugar levels. The worrying thing is that in its early stages, diabetic retinopathy has no symptoms. It is completely silent. What happens if you ignore the need for these exams? Diabetic retinopathy can progress without you realizing it, and by the time you finally notice something is wrong, the damage could already be irreversible. We're talking about partial vision loss or even total blindness. Not having regular eye exams puts you at unnecessary risk and could mean the difference between preserving your vision or losing it. According to the American Optometric Association's recommendations, people with type 2 diabetes should have an eye exam immediately after diagnosis. From there, it's crucial to maintain annual checkups to monitor any changes in your vision. In the case of type 1 diabetes, exams should start 5 years after the initial diagnosis. Studies have shown that people who have regular exams can detect and treat diabetic retinopathy early, significantly reducing the risk of serious complications. Number 2, ignoring symptoms of eye problems. The next mistake I want to highlight is ignoring the early symptoms of eye problems. Blurred vision, flashes of light, or dark spots in your visual field are not signs you should take lightly. These can be indicative of serious conditions, such as diabetic macular edema, where fluid accumulation in the macula, the part of the eye responsible for detailed central vision, can lead to rapid vision loss if not treated promptly. And if you ignore these symptoms, you risk allowing complications to progress to a point where there is no effective treatment left. Diabetic macular edema and other diabetes-related complications can develop quickly, and if you don't act immediately, you could face permanent vision loss. The American Diabetes Association warns that 40% of people with diabetes will experience some degree of diabetic retinopathy during their lifetime. The longer you ignore the symptoms, the greater the risk that complications will turn into irreversible problems. Early detection is key to managing these conditions and preventing serious damage. Number 3, not properly controlling blood sugar levels. Now, let's talk about something that is at the very heart of diabetes management: controlling blood sugar levels. Keeping your glucose within recommended levels is not only crucial for your overall health, but is absolutely vital for your eye health. High blood sugar levels damage blood vessels throughout the body, including the delicate vessels that nourish the retina. When glucose levels remain elevated for long periods, damage to the retinal blood vessels can lead to diabetic retinopathy. This damage not only causes blurred vision, but can also develop into more severe conditions like macular edema, glaucoma, or even retinal detachment. And the worst part is that this damage can be irreversible if not controlled in time. A key study conducted by the Diabetes Control and Complications Trial, known as the DCCT, showed that strict blood glucose control can reduce the risk of developing diabetic retinopathy by an impressive 76%. This underscores the importance of maintaining rigorous control over your blood sugar levels to prevent eye complications. Number 4, smoking or being exposed to tobacco smoke. Another critical mistake that many people don't directly associate with vision is smoking or being exposed to tobacco smoke. Tobacco not only damages the lungs and heart, it is also a silent enemy for your eyes. Smoking severely affects blood circulation throughout the body, including the tiny blood vessels that nourish your eyes. If you smoke, you significantly increase your risk of developing diabetic retinopathy, glaucoma, and cataracts. All of these are serious problems that can lead to vision loss. Additionally, tobacco smoke contains toxins that can irritate and damage the surface of the eye, leading to dry eye and a greater susceptibility to infections. A study published in the British Journal of Ophthalmology revealed that smokers with diabetes have a significantly higher risk of developing severe eye complications. The study emphasizes the direct link between tobacco use and the deterioration of visual health in people with diabetes. Number 5, neglecting diet and hydration. Finally, we can't talk about eye care without mentioning the importance of a proper diet and good hydration. Nutrients like omega-3 fatty acids, lutein, zeaxanthin, vitamin C, and vitamin E play a crucial role in eye health. These nutrients protect the eyes from cellular degeneration and promote healthy vision. A poor diet low in these essential nutrients can contribute to macular degeneration and other eye diseases. Additionally, dehydration can lead to dry eyes, which is not only uncomfortable but also can predispose you to infections and other eye health issues. A study published in the journal Ophthalmology showed that a diet rich in antioxidants and omega-3 can significantly reduce the risk of developing age-related macular degeneration, which is an increasing concern among people with diabetes. These findings reinforce the idea that what you eat directly affects the health of your eyes. Now that you know how to protect your vision and avoid common mistakes that can affect your eyes if you have diabetes, it's also important to stay informed about the early signs of diabetes, especially if you are over 50. In this video, we explain how you can recognize these signs early on. The sooner you know, the better you can protect yourself.